Yeah, this is Doug Fields, CEO of the Institute of Healthcare Consumers, along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. And we're very pleased to have joining us today Jim O'Connor, the president of CBIZ Employee Benefit Services. And Jim oversees one of the nation's largest benefit advisory firms. Jim, good morning.
Good morning. How are you this morning?
We're great. Good to have you here. You coming to us from New Jersey today?
I am indeed.
Great. Hope it's okay up there and not too cold.
No, not yet. The winter's still getting up on us, but not here all fully in yet.
Hey, Jim, for our audience, I mean, most people know the brand CBIZ, but give them a little background around CBIZ, and then we'll roll up our sleeves and talk about workplace wellness a little bit.
Sure. We're a publicly traded company, and we've got two primary business areas of focus. One would be our financial services side, which would be our accounting practice and other financial services provided to employers typically in the middle market. And then the other side of our business is our employee services side. And as you indicated, I oversee our employee benefits consulting and administration practice, and we also do retirement plan services, property and casualty, risk management, and other business services in the HR and benefits management space throughout the country.
Well, Jim, you have a pretty interesting view of the marketplace through the eyes of what you and your team are doing, working with a great number of employers out there. And, talk to us about workplace wellness, and that is a viable solution to really help employers get, as one way, get their arms around healthcare costs.
Yeah, absolutely. It's probably, in my view, and many of us that are deep end of the pool in the wellness space, the most important strategy avenue for an employer to go down as it relates to curtailing their rising healthcare costs. Mm-hmm. Forever, employers have looked at plan design and raising deductibles and cost shifting, and that's really kind of a road that has an end to it. And we really need to get to the root causes of what's driving up health insurance costs for employers and then subsequently for their employees. And that's the use of healthcare services, yep. Right? How often you're going to the doctor and using facilities or prescriptions, et cetera. But fundamentally, a healthier population will consume less health care services and therefore have less upward pressure on the health insurance costs of an employer. So wellness programs, well-designed, innovative wellness programs, are central to an employer strategy for curtailing their health care cost inflation.
Jim, I think that, we concur with you. We see this, and we're involved with HERO as well, very closely with helping them do some survey work, and it's a big footprint for us. And it's interesting because as we look back in the history of wellness, in many cases it hasn't delivered on the promises, and so traditionally when it doesn't work for businesses, they move away. But it's quite the opposite, today is where you working with employers themselves saying, hey, we got to figure out this piece, and we got to be realistic about what we have it do, correct?
I think you hit on two key things, being realistic and then figuring it out. And let me stay with that for a minute, because in the past, I've been doing this business for going on 30 years, and in the past, and even there's some still limited view today, you say the word wellness and people quickly revert to thinking gym reimbursements, yeah, or smoke enders. And while those are valuable pieces to a broad-based wellness culture at an organization, they are not unto themselves a strategy, number one. And number two, employers historically were looking for too much of a quick fix. And to have an effective wellness strategy, you have to have the longer view. I'm not suggesting that a well-designed, implemented wellness program won't have an ROI in the first, 12 to 18 months. It will, and it absolutely will, but that's not the end game. The end game is the journey to create a healthier population over the longer term, and employers historically have said, I'm going to have employee turnover, so I'm not going to be, getting my ROI on it over the long term. That's being dispelled, and the programs that are in place today that have been in place for 5, 8, 10 years now are demonstrating that the employers that are sticking to it and really pushing the envelope relative to wellness innovation, and we can talk about what that looks like, are getting the ROI for sure.
Jim, when you, from a compliance standpoint, how can the employer ensure that their wellness program that they're putting in place is ACA compliant?
Yeah, real important question. And first and foremost, and this will sound self-serving, but it's not just an advertisement for CBIZ. It's for any benefits consulting firm that really is into the wellness space. An employer has to work with professionals first and foremost that know the business, and the key there is going to be not only asking about their expertise and listening to someone tell you what they will do for you going forward, but where have they come from? What's their experience in wellness design, and that wellness design being in compliance with ACA and other governing bodies. It's not just about ACA, it's EEOC and other governing bodies that weigh in on these things. So first of all, the wellness consultant, the benefits consultant, making sure that they know what they're doing. And then secondly, the wellness vendors that you're going to be contracting with. This is such a growing space, and any time you've got new players every week coming into a business, you need to be careful about their credentials and their knowledge relative to regulations and compliance. Now, having said that, the key areas with ACA, and I'll distill them down to the main ones because there's other ones as well, but first and foremost, it's focused on what we call results-based or outcomes-based wellness programs. Mm-hmm. And that's where ACA says you basically can use 5 biometric markers to measure in a results-based program. And that's going to be your BMI, it's going to be your LDL cholesterol, it's going to be your glucose, it's going to be your blood pressure, and then it's going to be tobacco use or not. So you can't go beyond those 5 markers today. Those are the ones that are the only ones you can use in a results-based program. The other 2 key things for the listeners relative to results-based programs are, number 2, the employee has to have the ability to have an appeal the results. So let's say, for example, your blood pressure reading was 150 over 100, and you're normally 120 over 80, but you're having a bad day getting to work, etc. You have to have the ability to appeal the outcome and get a redo. So that's a requirement under ACA. Number 3, you also have to have what's called alternative reasonable outcome. So let's say, for example, the BMI measure is something that you'll never get to based upon your own personal medical conditions. Well, you have to have a personal alternative goal assigned to you that's different than the standard established in the program. So those are the keys for the ACA. But again, for the listeners, make sure you're working with consultants and advisors that are really up to speed on all of this.
Yeah, and I think when we step back and look at total wellness too, and or health management, there's a lot of different terms out there, Jim. When you agree, this is not just about helping the well stay well. This is about helping those with chronic disease states better manage those disease states. Correct?
Oh, absolutely. You hit it right on. The one criticism of, again, I'll go back to the gym reimbursements. The argument was, well, I'm only going to be giving out these rewards to people that are already going to the gym, so I'm just rewarding people that are already displaying the correct behavior. The other end of the spectrum is our catastrophic claimants. We're never going to leave the world where the unexpected tragic event occurs, and you really can't manage to that. But what you can manage to, and the proper design of a well-functioning wellness program, is to target, A, people with chronic diseases, and how are they being managed and managing them properly. And the other is the people we don't know about. The greatest fear is we don't know what we don't know. And historically, from an insurance underwriting perspective, you'd ignore the population that don't have any claims. Well, what we've come to understand is that's where your ticking time bombs are. Because if people are not incurring claims and the right kind of claims, then they're not managing their conditions, they're not getting their preventive screenings, they're not doing what they should do to remain healthy while properly using the healthcare system. And so your zero claimant today, 2 or 3 years from now, might be your terrible cardiac claimant or your diabetic that's now unmanaged. And so we have to have programs that address the behavior and proper behavior of health management on those kind of mid-level and possibly emerging claimants that can be avoided. Study after study will tell you that 65 to 75% of the healthcare spend in this country is either fully avoidable or the financial impact can be minimized simply by individual behavior and choices. And so that's where the wellness programs can really get to helping people make the right choices, have a more healthy lifestyle. And again, the financial win for that both accrues to the employer as well as to the employee who's participating in the cost of programs today.
Yeah, I think that's a good point. And that's where, that's a risk management scenario that a CFO will understand too, correct?
Absolutely. This is absolutely a CFO and, quite frankly, a CEO conversation. The risk management, when you think about any of the risk-based purchase we as individuals or employers make, we look to mitigate that risk, whether it's property insurance or commercial auto, or even if you and I are just doing our own personal purchasing of auto insurance, et cetera. It seems like the world of employee health insurance, we just kind of have let it go to luck and then plan design and cost shifting. So absolutely, this is about risk management. And you think about the size of the spend, right? Whether you're a middle market or a larger employer still purchasing a fully insured plan from an insurance carrier, or you're doing self-insurance, let's get after managing those risks. And we're not going to avoid them completely, but let's minimize the financial impact through proper management, and that's what wellness programs do.
Hey, Jim, listen, time flies when we're talking about this subject. It's deep and wide, and we need to have you on again. You got about 30 seconds. Can you give our audience a wrap and tell them how they can get in contact with you, please?
Yeah, sure thing. So personally, I'll give you my email address. My name is Jim O'Connor, and the email is JOCONNOR at CBIZ.com, CBIZ.com, JO'Connor@CBIZ.com. The real wrap is, if you are a CFO or an HR manager purchasing employee benefits today, you have to have wellness programs as a key component to your strategy. We are not going to curtail the rising cost of healthcare in our country without creating a healthier population, and employers play a key role in that, and it's both a win for the employer, a win for the employees from a financial, a productivity, and a lifestyle improvement perspective.
Hey, Jim, really enjoyed the discussion. Thanks for taking the time out of your day, and have a great weekend up there.
Thank you, gentlemen. Have a good weekend. Bye-bye.
Thanks. And to the rest of our audience, stay tuned for the next segment of Healthcare Consumers on Radio.